I'm about to tell you something that might save your life. If you're over 60 and living with diabetes, the advice you've been following could be completely wrong for your age. Stay with me, because what I'm about to share changes everything. Here's the shocking truth. The diabetes management strategies that work for younger people can actually be dangerous for seniors. Your body doesn't respond the same way anymore. Your risks are different. Your goals should be different too. Why does nobody talk about this? Because most diabetes education treats everyone the same. But research shows that seniors need a completely different approach. And ignoring this fact leads to serious consequences. Let me explain what's really happening in your body after 60. Your metabolism slows down significantly. Your kidneys don't filter medications as efficiently. Your risk of hypoglycemia, or dangerously low blood sugar, increases dramatically. These aren't small changes. They're life-altering differences that require a new strategy. The first major mistake seniors make is following the same strict blood sugar targets as younger diabetics. Most doctors recommend keeping your A1C below 7. That makes sense for a 40-year-old. But for someone over 70, especially if you live alone, this target might be too aggressive. Here's why that matters. When you push your blood sugar too low, you increase your risk of falls. Falls lead to fractures. Fractures lead to hospitalization. Hospitalization often leads to loss of independence. See how this domino effect works? One overly strict blood sugar goal can cascade into life-changing consequences. Research published in the Journal of the American Geriatric Society found that seniors with A1C levels between 7 and 8 actually had better outcomes than those below 7. They had fewer emergency room visits. They maintained their independence longer. They had better quality of life overall. But here's what you need to understand. I'm not saying ignore your blood sugar. I'm saying your targets should match your individual situation. If you're 75, living alone, and have other health conditions, your doctor should set more relaxed goals. If you're 65, active, and otherwise healthy, stricter control might still make sense. Now let's talk about the second critical mistake. Many seniors take too many diabetes medications. This happens gradually over years. Your doctor adds one medication, then another, then another. Before you know it, you're taking 5 or 6 different pills, plus insulin. Each medication increases your risk of side effects. More importantly, they interact with each other in ways that become unpredictable as you age. Your liver and kidneys process these drugs differently than they did 10 years ago. What worked safely before might now be causing problems you don't even recognize. Symptoms like confusion, dizziness, or fatigue often get blamed on aging. But frequently, they're side effects of medication overload. One study found that seniors taking multiple diabetes medications had twice the rate of cognitive decline compared to those on simpler regimens. So what should you do instead? Ask your doctor about medication review. This is a systematic process where you go through every single medication and ask, do I still need this? Is the dose still appropriate for my age? Are there safer alternatives? Could we simplify my regimen? Many seniors can actually reduce their medications safely. Sometimes you can switch from multiple pills to one combination medication. Sometimes you can eliminate drugs that aren't providing enough benefit to justify their risks. The goal is the simplest regimen that keeps you healthy and independent. The third mistake involves diet, and this one surprises most people. Seniors often follow overly restrictive diets that actually harm their health. You've probably heard you should avoid all sugar, limit carbs severely, or follow some strict meal plan. But here's the problem. As you age, maintaining adequate nutrition becomes more important than perfect blood sugar control. Severe dietary restrictions can lead to weight loss you can't afford. They can cause nutritional deficiencies. They can make eating so unpleasant that you don't eat enough. Malnutrition is a serious problem for seniors with diabetes. It weakens your immune system. It slows wound healing. It increases your risk of infections and complications. And ironically, it can make your diabetes harder to control, not easier. What works better? A balanced, flexible approach to eating. Yes, you should watch your carbohydrate intake. But you don't need to eliminate carbs completely. Focus on getting enough protein to maintain muscle mass. Include plenty of vegetables for vitamins and fiber. Allow yourself occasional treats so eating remains enjoyable. One practical tip: aim for 30 grams of protein at each meal. This helps preserve muscle, which is crucial for maintaining independence. Good sources include eggs, fish, chicken, Greek yogurt, and legumes. Pair your protein with non-starchy vegetables and a moderate portion of whole grains. Now let's discuss exercise, the fourth area where seniors make critical mistakes. Many people with diabetes either exercise too much or not at all. Both extremes cause problems. Exercising too intensely can trigger dangerous blood sugar drops. This is especially risky if you take insulin or certain oral medications. You might feel fine during exercise, then experience severe hypoglycemia hours later. This delayed effect catches many seniors off guard. On the other hand, avoiding exercise altogether accelerates muscle loss. After 60, you naturally lose muscle mass at a faster rate. This condition, called sarcopenia, makes everything harder. Walking becomes difficult. Balance deteriorates. Independence slips away. The solution? Moderate, consistent activity tailored to your abilities. Walking is excellent. Aim for 20 to 30 minutes most days. Add some resistance training twice a week. This could be simple bodyweight exercises, resistance bands, or light weights. Strength training is especially important. It preserves muscle mass. It improves insulin sensitivity. It enhances balance and reduces fall risk. You don't need to lift heavy weights. Even simple exercises like chair squats, wall push-ups, and standing leg raises make a significant difference. Always check your blood sugar before and after exercise. If it's below 100 before you start, have a small snack. Carry glucose tablets or juice when you exercise. Tell someone your exercise plans. These simple precautions prevent dangerous situations. The fifth mistake involves monitoring. Some seniors check their blood sugar obsessively. Others rarely check at all. Finding the right balance is crucial. Checking too often creates anxiety and stress. You become fixated on every small fluctuation. This stress actually raises your blood sugar, creating a vicious cycle. Plus, frequent finger sticks hurt. The cost of test strips adds up. And all that data becomes overwhelming. But checking too rarely means you miss important patterns. You don't know how foods affect you. You can't detect dangerous trends. You might not realize your medications need adjustment. What's the right frequency? It depends on your medications. If you take insulin, you need to check more often. If you manage diabetes with diet and pills that don't cause low blood sugar, you might only need to check a few times per week. Work with your doctor to create a monitoring schedule that makes sense for you. Focus on checking at strategic times. Before meals tells you if you are starting in a good range. 2 hours after meals shows how foods affect you. Before bed ensures you are safe overnight. Consider a continuous glucose monitor if you're on insulin. These devices track your blood sugar constantly without finger sticks. They alert you to dangerous highs and lows. Many seniors find them life-changing. Medicare covers them for insulin users. Now here's something doctors rarely discuss. Social isolation makes diabetes management much harder. When you live alone or lack social connections, everything becomes more difficult. You're less motivated to cook healthy meals. You skip exercise. You forget medications. Depression sets in. Studies show that seniors with strong social connections have better diabetes control. They have fewer complications. They maintain their independence longer. Social engagement literally improves your health outcomes. What can you do about this? Join a senior center. Attend a diabetes support group. Take a class. Volunteer. Connect with neighbors. Even regular phone calls with friends make a difference. Social connection isn't a luxury. It's a crucial part of managing diabetes successfully. Another often overlooked factor is sleep. Poor sleep makes diabetes worse. It increases insulin resistance. It triggers cravings for unhealthy foods. It impairs your judgment about medication and diet. Yet many seniors struggle with sleep problems. Common issues include sleep apnea, frequent nighttime urination, and medication side effects. Address these problems directly. Ask your doctor about sleep apnea testing if you snore or feel tired despite sleeping. Limit fluids before bed to reduce nighttime bathroom trips. Review medications that might interfere with sleep. Good sleep hygiene helps too. Keep your bedroom cool and dark. Stick to a consistent sleep schedule. Avoid screens before bed. Don't nap too long during the day. These simple habits improve sleep quality significantly. Let's talk about foot care, which becomes critically important as you age. Diabetes damages nerves and blood vessels in your feet. You might not feel injuries. Small wounds can become serious infections. In severe cases, this leads to amputations. Yet many seniors neglect their feet. They can't see them well. They have trouble reaching them. They don't realize how important foot care is. This neglect has devastating consequences. Here's what you must do. Inspect your feet daily. Use a mirror if you can't see the bottoms. Look for cuts, blisters, redness, or swelling. Wash your feet daily with mild soap and lukewarm water. Dry them thoroughly, especially between toes. Apply moisturizer, but not between toes. Wear proper shoes always. Never go barefoot, even indoors. Choose shoes with good support and room for your toes. Break in new shoes gradually. Check inside shoes before wearing them. Shake out any pebbles or debris. See a podiatrist regularly. They can trim your toenails safely, treat calluses, and identify problems early. Medicare covers podiatry visits for people with diabetes. Don't skip these appointments. They're crucial preventive care. Finally, let's discuss the mental and emotional aspects of diabetes management. Living with a chronic condition takes a psychological toll. You might feel frustrated, overwhelmed, or hopeless. These feelings are normal, but they interfere with self-care. Diabetes distress affects many seniors. You feel burned out from constant management. You resent dietary restrictions. You worry about complications. This emotional burden makes everything harder. Recognize that mental health is part of diabetes care. Talk to your doctor about how you're feeling. Consider counseling or therapy. Join a support group where you can share experiences with others who understand. Practice self-compassion. You won't be perfect every day. You'll make mistakes. That's okay. What matters is getting back on track, not achieving perfection. Focus on progress, not perfection. Remember why you're managing your diabetes. It's not about hitting arbitrary numbers. It's about maintaining your independence. It's about doing the activities you love. It's about spending quality time with family and friends. Keep these meaningful goals in mind when motivation wanes. So here's what you need to take away from all this. Managing diabetes as a senior requires a different approach than when you were younger. Your blood sugar targets should be individualized. Your medications should be reviewed regularly. Your diet should prioritize nutrition over restriction. Your exercise should be moderate and consistent. Pay attention to factors beyond blood sugar. Get enough sleep. Stay socially connected. Take care of your feet. Address your emotional well-being. These elements are just as important as medication and diet. Work closely with your healthcare team. Don't be afraid to ask questions. Advocate for an approach that fits your individual circumstances. The goal isn't perfect blood sugar control. The goal is maintaining your health, independence, and quality of life for as long as possible. Take action today. Schedule a medication review with your doctor. Start a simple exercise routine. Connect with one friend or family member. Check your feet tonight. Small steps lead to big improvements. Your independence is worth protecting. You have the power to manage diabetes successfully at any age.